So one of the things that I like very much with this digital implantology is the possibility of being very accurate. That means that I know already where the bone is, and then I create some device, some surgical guide that will lead me all the way through that situation. Now, one of the things that we normally see is when you're doing a very narrow situation where you don't have a lot of bone. You fall down in some situations where you can do damage to the patient. That means that because you're not sure where the bone is, two things happen. One, you have to open big flaps and big retractions. Or the other is that you don't do a lot of big flaps and you fall down on a buccolingual situation where if the implant is too buccal, then you have recession and you start to have aesthetic problems. Now, the lateral incisors, they normally represent well that situation. In orthodontic patients seeing this situation, you have two problems over here. One is to take out the impression, but that is solved, like I showed you in the case before, that you can now do a digital impression and send it to the lab without taking a notch in it. The second is the correct position of the implant. How many times the orthodontics takes to the implantology suite and says, is there enough room to place an implant? And normally the rules are tipping or you have a small diameter space. Now, with the advantage of placing small diameter implants, like for example the 2.9 from the Straumann company, is that you can use every bone available in these small spaces. But the tricky part is to place the implant on the bone and on the correct prosthodontic alignment, which is very difficult because if you aim for a screw-retained restoration on the lateral incisor, that's very difficult in freehand. But digitally, you can plan the situation and stay within the bony walls by having a surgical guide to guide you. Now, this is where the digital softwares will come in place. And now this is an illustration how your planning and how your surgical guide would be made according to the situation. Now, once again, we have orthodontics here, and this is very helpful in guiding you for the final implant position. Now, because it's a small diameter implant, you only need the first burr. So it's like you only have one shot to do the correct drilling. There's no drilling corrections because there's no more burrs. If this is a 2.9 implant, you have a burr that is 2.2. There is no extra burr. So if you're not accurate enough on the first burr, then the whole case can be a mess. So this is a perfect example how digital technology can help you. Now, this is the same situation. You're going to produce a surgical guide that on the day of the surgery you're going to use to guide your implant. And then you don't have to open a big flap. You don't have to retract a lot in order to find the correct position for your implant because that's already planned on the software since day one. Now, the only thing you have to do is follow this guideline and see once again how digital dentistry came to help you a lot. Look at this picture. You have brackets everywhere. To do an impression on these cases? Of course not. Very difficult. So you're going to do an impression, a digital impression, to guide you in a 2.9 situation freehand? Of course not. It would be impossible. You have to open flaps everywhere in order to be sure that you're in the bone. To do a screw retain restoration on the lateral incisor is also very tricky because you know that your offset of your implant will tend to perforate that buccal wall. So you have a lot of variables that it looks like a straightforward case, but it's not a straightforward case. So this is a perfect example, and for me, one of the best examples how digital dentistry came to change our daily lives. And look at the picture. This is the final drill already in place. Did I open a big flap? No, that's perfect for patients. That's perfect for teeth and the surrounding bone. You avoid recessions and other problems. Imagine that you have two crowns on the lateral and central incisor. It would be a mess. Then you would go for papilla-saving incisions and so on and so on. But now you have, if you don't have to use guided bone regeneration like in this case, then the surgical guide would perfectly guide you along the way. And here's the implant placed. This is the final x-ray for implant checking. This is very accurate. It means that you can really hit that 2.9 bone left in order to place a dental implant. And the patient says thank you. Says thank you, and when you take the picture, you still very happy because you just nail it. You just place it where it should go. And this is the perfect example of this.